we want the patients to come into the room and be educated about their disease so that the doctors can communicate with them on a different level, and they leave the room, everybody leaves the room feeling better about what just happened.
When saving lives is what you do, your standards are anything but standard. In fact, you set them higher than most to deliver results that patients can depend on. You refuse to compromise. We couldn't agree more. We are Edwards Life Sciences, and like you, we believe that good is never good enough. Rising to the challenge of today's TAVR patients isn't just a mission, it's a commitment. And because you set a higher standard, we set our sights on meeting you there. Welcome to the higher standard, your standard. Learn more at edwardstavr.com.
You're listening to Parallax from Radcliffe Cardiology in association with makeadent.org. Here is your host, Ankur Kalra, MD.
Hello, everyone. Welcome to another episode of Parallax. It still is the heart month, February. And, I think today's episode is going to be a special one. We've, in the past, in season 3, we introduced the concept of patient episodes, and I just wanted to build up on that platform that, our patients have allowed us the privilege to build, to sort of be their voices as well as the voices of our own, cardiologists and colleagues. I think voices from patients are equally important, if not more important. One would argue they're more important because, we are, because patients are. So with that introduction, my guest today is Joe Valente. Now, I was just talking off the line with Joe, how him and I met. It's through Twitter, so we have not met in real life. We've only introduced each other on Twitter. And I was enamored and attracted to his resume because on his Twitter header, it says that he's a board-certified patient advocate, and that's something which is new to me. So Joe Valente is a board-certified patient advocate. He is a tetralogy fellow patient. He has been operated upon 4 times, and he is someone who has transformed his pain to purpose, in my opinion, in my humble opinion. And that is very respectable and inspirational and attractive to me as a cardiologist and as someone who does procedures and someone who's a father of a child who had open heart surgery for congenital heart lesion, last year. So Joe, welcome on the show, and thank you so much for doing this for us.
Well, thanks for having me, Ankur. I appreciate that, and I appreciate the introduction.
So Joe, I think before we begin, I think for the listenership, the vast majority of which are cardiologists and fellows in training and early career, mid-career cardiologists, can you tell us more about board certification and patient advocacy? Because I think that's the first time I came across someone who has a board certification in patient advocacy, and I think more and more it's becoming an extremely important topic in our conversations with our patients, and we truly value individuals like yourself for patient advocates.
Yeah, so I was actually in the first cohort to become board certified in patient advocacy in the country, which was in 2018. So it's a new board certification. That's why you probably haven't seen it so much. And so it's the board certification entails testing and demonstrating your knowledge in medical ethics, in culturally and linguistically appropriate services, in medical knowledge, in things that you would be involved in advocacy, like Medicare and Medicaid, and other areas of advocacy work. So it involves testing, it involves, continuing ed, just like you would with any sort of board certification. So when I set out on this path, I started helping patients in 2016. It was, how do I show my credentials to anyone? There was no way to do it. And I think for a lot of advocates, it was, it's the same way. And so this board certification is a great way for us to say, hey, we have the knowledge, we have the experience, and here we are to help you. And so the patient advocates can either be institutional patient advocates working, for a hospital, or they can be independent patient advocates who, work on their own like I do. I have a nonprofit called Team Uncle Joe, and we work one-on-one with patients, both children and adults who have congenital heart disease, and we help them navigate the healthcare system and equip them with the tools and resources they need to thrive with congenital heart disease.
Well, that's excellent. And we're going to talk a little bit more about your nonprofit. But in terms of, other patient advocates who are listening to this episode, and I hope that they will, and the more will share, because, we've had extremely passionate and involved and educated and learned patients on the show. I'm going to name one of them, Lindsey Davis, who was on Parallax last year. She has hypertrophic cardiomyopathy. Now she also has a law attributed to her name and has been a fierce patient advocate, has been working with, the American Heart Association. Hopefully soon is going to work with the World Heart Federation. But if patients like her and someone like you is listening, how do you get the materials to, master for this board certification? First of all, if you can walk us through the process, even for cardiologists who are listening, who have involved patients and, who are interested in becoming board certified patient advocates, how do we educate our involved patients about seeking the certification out? Like, is there an online forum? Are there deadlines, application deadlines?
Yeah. So I think the first thing is to understand that there's two different types of patient advocates. There's legislative types of patient advocates that would go out and advocate for, changes to legislation and that kind of stuff. And then there's patient advocates that are more like a patient navigator that help other patients. Well, if you're a patient, you help other patients that need help navigating the healthcare system. And so board certified patient advocate is that type of patient advocate. So I think that's the first key takeaway. So the patients that are listening, that's the type of board certified patient advocate that we're talking about. Second, if you go to the Patient Advocate Certification Board, pacboard.org, there is a list of materials, study materials, and deadlines for this board certification test. They offer the test twice a year. It's in March and in, I believe, September. It's twice a year, and there's materials there to study from and other resources and links out to other classes and other materials that you can follow along with. There's also their guidelines for the ethics of what a board certified patient advocate's allowed to do and not allowed to do. You're not allowed to give medical advice and things like that. So it's very, laid out in very clear terms. So they have all that on that website. That's the first place to start if you're looking to become a board certified patient advocate.
Well, excellent. All right. So moving on, tell us about tetralogy of Fallot from your perspective as a patient. I mean, you've had 4 open heart surgeries. So for the adult congenital heart disease cardiologists or fellows in training or patients listening, what has been your I'm going to break this into 2 parts. One, the most educational experience, and 2, the most empowering experience. So if you want to answer those questions for us.
I think the most educational experience has been learning how to communicate with doctors and providers. This is congenital heart disease is a lifelong disease, and we're learning more and more about that. We used to think that, oh, you were fixed in childhood and you could go on your way and never be fixed. And especially with tetralogy, we thought, we put in your transannular patch and, you had free PI and you could live the rest of your life and be okay. And now we're learning that's not the way it is. We need to replace your pulmonary valve in adulthood, and you need to be followed. And, there's other side effects that are coming up in adulthood that we'd had no idea about, 10, 20 years ago. And so it's a lifelong disease. And so we're constantly in communication with our doctors. And the biggest learning experience for me has been how to communicate with my doctors, and not only doctors, but other providers. And learning that communication has enabled me to become a patient advocate and help other people communicate with their doctors. And so to me, it's about not only getting the most out of being in the room with your doctor. You only have so much time. The doctor only has so much time. How can we have the most efficient time in the room together? How do we ask the best questions? How do we get the best answers? How do we understand the answers? So that comes down to things like being educated about your disease, trying to understand what's going on and come equipped with the right questions before you even walk in the room.
And, to answer the second part of the question about what has been the most empowering experience for you as a patient who's as involved and as educated as you are.
Yeah, I think it's that you learn that life is, finite, and that you learn that you're going to live life to do what you want to do, not what anybody else wants you to do. And you find what makes you happy, and you work towards that goal, and you do it at any cost. And some days it's really hard. But I'm 10 years out this next month in March from my last open heart surgery. And within this last 10 years has been when I really put myself to this patient advocacy and helping other patients, and realizing that I had a skill set to do that. And I took some pretty radical changes in my life to get on that path. But I think that going through that surgery, and I had a pretty hard recovery, and it makes your mindset about life a little bit different, I think, than maybe some of your peers at a young age. I mean, I was 30 years old. I was waking up on my 30th birthday in the CVICU, the pediatric CVICU. I was walking down the aisle, after my surgery with a 6-year-old by my side who had just got out of open heart surgery too. And, that really sets your perspective on life at a little different pace. So I would say that, just having that different perspective on life and being able to take that every day with you and do what you love.
Yeah, and I think that I'm sure that's going to resonate with, patients, physicians, cardiologists, people alike. That's a very, very important message, very empowering message, very heartfelt message. And you put it so eloquently that, I just feel inspired listening to you, and thank you for. Like I said, earlier in the show, transforming your pain into purpose. I think that's the highest calling for any one of us, quite frankly. And I really congratulate you for taking the path that is meaningful to you, that gives you purpose, that actually encompasses your experiences in childhood, early adulthood, and sort of has become the beacon for transforming lives for other patients who are dealing with similar scenario as you have in the past. And congratulations, by the way, for being a decade free from surgeries for tetralogy of Fallot. That's incredible. So Joe, why don't we get to talking about a little bit about your nonprofit, which is teamunclejoe.org. When did you decide that you want to form? I'm assuming this is a 501c3. Having gone through the paperwork for mine, I know it's a substantial amount of commitment and dedication and devotion to forming an organization like this. But when was it that you felt strongly about starting a nonprofit with a mission for helping patients with congenital heart disease? I think that's a very noble mission. And then what are some of the things that you learned along the way? And this is also for other patients who want to form nonprofits like yourself, or physicians like myself, who have formed nonprofits of their own. What are some of the lessons that you learned that you would like to share with all of us?
It's like you said, it's a daunting task. It takes a lot of work to become a nonprofit, to file a 501c3, and it's a lot of work to keep it running on a day-to-day basis to actually be a nonprofit and go out there and get donors and to do all that stuff. We provide our services to patients free of charge, because we believe that providing those services free of charge allows the patients to come to us before they're in trouble, before they need help. And so in order to do that, we fundraise, we get donors to help us supplement our services, and so that we can provide those services free of charge. And so it's been a long journey to get here. In 2016, I started providing some patient advocacy services to patients, and at that time realized that, hey, maybe this is a bigger calling, and there has to be other patients out there that are doing the same thing, that have this knowledge. I had my first open heart surgery at 54 hours old. I've been a patient my whole life, and that's not an exaggeration. And we have all this experience. How can we take it to become a professional? How can we train these people to actually be, board certified patient advocates and become professionals in helping other patients? And so that's what we're about, is taking this knowledge that these patients have, putting it together with their maybe professional experiences, and then taking it to the next level and being able to help patients navigate the healthcare system. And so, but I think that, you're always a little bit more ambitious about these things and how they'll come together than once they actually happen. And so once you're doing it and you're in the trenches, you realize how much work it is. So I think my advice to anybody is, find all your allies before you start, and see what kind of team you can amass before you get into it, because it's going to be more work than you initially think. It's definitely difficult to run a nonprofit, and any business for that matter, or venture that you're looking to take on. So just do it with an ounce of pessimism, because it will have its challenges, and the more people you have on your team before you start, the better off you'll be.
Well, that's a great perspective on the labor of love that a nonprofit truly is, because it can just take hours and hours, and as long as it's driven for a higher purpose than you, then you're going to enjoy the labor and the love that you put into creating the nonprofit, and then it's going to give you a lot of joy and a lot of satisfaction. And I'm sure that's the feeling that I have for my nonprofit. I'm sure these words and these feelings resonate with you as well.
Oh yeah, definitely. That's yeah. I would totally second that. It's as long as you're doing it for the right reasons and you feel passionate about that, I think that's the key to it all.
So is the nonprofit for anyone and everyone with the congenital heart disease who finds about your nonprofit? Can they just approach you directly through your website, or?
Yeah. Anybody that has congenital heart disease can get our services. Like I said before, we work with kids and adults who have congenital heart disease. So we work with the families, and we help them. Every patient that comes and sees us, has a different story or a different twist on the story, but we help them navigate the healthcare system. We help them understand their disease. We help them communicate with their doctor. So it's always a little bit different story. Our motto is elevating expectations. We try to elevate the expectations of the patients, of what they expect of their doctor. We try to elevate the expectations of what the doctor expects of their patients. We try to elevate the expectations of what the patients expect from the nonprofits that serve them. So, we want the patients to come into the room and be educated about their disease so that the doctors can communicate with them on a different level, and they leave the room, everybody leaves the room feeling better about what just happened. And so that's our mission.
Like I said before, that's a very noble mission. So walk me through how, if a patient finds out about your nonprofit, walk me through the steps that patients usually experience once they start an interaction or interacting with the team at teamunclejoe.org. What does the typical patient flow looks like?
So usually they get in contact with us via our website. We have a contact form on there, a chat bot on there that they can contact us and give us a little bit of information. And then initially I usually do the intakes myself, and I will have a phone call with them and figure out what their issues are, what they're trying to navigate. And then from there, I will kind of triage it to who's the best team member on our team to take care of that issue, or coordinate with the team to answer some of the questions they have, and get that information back to them to continue going on. And then from there, it's an open-ended communication line. Some of our, for instance, one of the advocates that works for us has worked in the insurance industry and health insurance for the last 20 years. So any health insurance questions, if that's what they're trying to navigate, are going to go through her. And so we kind of triage the questions depending on who's the best to navigate that. If they have multiple questions, then, we go from there. And then, if it's communicating with your doctor, we'll go back and forth and sort of try to teach them how to do that. We try to give them the tools to do that. So it's more of it's a long-term thing. It's not just a simple answer. It's a long-term thing of how are you communicating with your doctor? Help them maybe compose an email. They send an email. Is this a good email to send to your doctor? Let's restructure it and put it in this way, to help them actually ask the questions to get the answers they're looking for, and teach them those kinds of things. And maybe give them some of the information, the underlying information that they need to ask a better question. So they're not starting off at step one. They're able to ask a more refined question because we're able to give them some of the underlying information. What does this mean? What does this mean? What does this mean? That are basic information that we already know that we can provide them, and then get them to the actual question that the doctor can answer.
When you are sort of educating patients about communication with their physicians, and I think you mentioned that you are accompanying them to their patient visits also, is that right?
Yes, sometimes. Yeah, a lot of our services are virtual, but sometimes we do accompany them to appointments. Yes.
Understood. What has some of the feedback been for the nonprofit organization in terms of how patients have felt after working with your organization?
It's been a lot of gratitude. Some of the patients have been, I have some families in particular that, tell me that their kid may not be here if it wasn't for us helping them get to the services they needed because they didn't realize how sick their kid was or something like that. And, those are the cases that I take away that really keep me going, because it's, congenital heart care is really specified, and it's such a unique practice that there's not services everywhere in the country, and it's hard to get to care sometimes, and getting somebody to the right care in the right place at the right time is sometimes what we do, and helping somebody do that is really rewarding. And so when we're able to do that and get that feedback, that's been the most rewarding, and that's been phenomenal.
Excellent. So, Joe, for patients who are listening, and also for cardiologists who may want to refer their patients to your nonprofit, particularly my adult congenital heart disease fellows in training and colleagues, can you spell out or specify, your email, perhaps your email address or your website where they can reach you at, if they need help?
Sure. So it's Joev, Joev, at teamunclejoe.org, teamunclejoe.org.
So that's Joe V. Yeah, it's Joev, and we'll put that in the show notes as well. In case people have issues, figuring out the spellings or the details, or they're listening while driving. You can just go back to the show notes of the episode and take a look at the email address. It's joev@teamunclejoe.org, and that's where Joe Valente and his team are available to help you, either you or physicians and cardiologists who are listening, their patients, if they need more help from a professional nonprofit service, whose mission is to help take care of patients and their families. For those who have congenital heart disease. Any closing remarks, Joe, for us at Parallax, for patients who are inflicted with congenital heart disease and their families? Any closing remarks from you and your team?
I would just tell you that, congenital heart disease is a lifelong disease, and that, we're here to help you. And we provide one-on-one services that, not a lot of people are providing. So as you get, stuck along the way, there's always somebody here to help you. And we provide our services free of charge. And, it's, if you're out there and you feel like you need a little extra help, don't be afraid to ask, because, there's a lot of us out here who have walked this road before and had struggles, and it's okay to ask for help. And I'm just thankful to have the opportunity to share my story here today, and look forward to building some more connections based on this.
You're doing incredible work, and congratulations to you and your team for doing such important work and affecting the lives of patients and families that you've touched. Again, heartfelt congratulations from me as well as the entire team at Parallax.
All right. Thanks, Ankur. I appreciate it.
Thank you.
We hope you enjoyed today's podcast, produced by Radcliffe Cardiology in association with makeadent.org. We aim to bring you a new angle of all things cardiology every second week. Review us on your favourite podcast app or send your comments or questions to podcast@radcliffe-group.com. To view the series, head to radcliffecardiology.com/podcasts/Parallax. Thanks for listening.